Okay, so now let us talk about the ureter. So the ureter, okay, it comes from the hilum of the what? The kidney. Okay, so the ureter forms part of the collecting system of the what? Of the kidney. We have this part called the functional part of the kidney, and we have this part called the collecting part of the what? The kidney. Alright, so what happens is the kidney, it will drain its contents in what are called what? The minor calyces. Okay, it will drain its content into the minor calyces, which then unite to form what's called the major calyces, and these major calyces will unite, okay, to form what's called the renal pelvis. So the renal pelvis is like the proximal part of the what? The ureter. Then the ureter would descend down into the abdominal region. It will descend being in the posterior abdominal wall. So the ureter, as it is descending, it has three major constrictions. It is the constriction here where it is in communication with its first part called the renal pelvis. So here is a very important constriction site because it is usually the constriction sites of the ureters are the sites where we find ureteric stones. Okay, ureteric stones, like there are these little stones which will impede urine from moving from the kidney into the blood. Okay, this is the first site. Then the second site will be here. Okay, it will be here at the level of the what? The pelvic brim. As the ureters are now trying to enter into the true pelvis, there's another kinkiness or a constriction, another site of ureteric stones. Then another site will be when now the ureters are entering into the posterior surface of the blood. Okay, so the ureters they enter differently according to the what? To the sex. For example, in males, as they are entering into the posterior aspect of the bladder, they cross what are called the ductus deferens. While in females, okay, they will enter in what is called the broad ligament of the uterus. Okay, so the broad ligament of the uterus forms like the weak support of the what? The uterus. The broad ligament will connect the uterus to the lateral pelvic walls. Okay, so there is a very important crossing over which happens between the ureter and the uterine artery. This one is very important because if we were to damage the uterine artery, we are more prone to damage even the right ureter at this junction, okay, or at this crossing off. So it's a very important clinical. Okay, then now the blood supply of these ureters, it receives blood supply from three portions. Okay, we have a portion which is near to the or the proximal portion. It receives blood supply from the renal artery. This is the upper portion. Then the middle portion will receive arterial supply from the gonadal arteries. Okay, meaning to say in males it will be the testicular artery, then in females it will be the ovarian artery. Done. Then the inferior portions will receive blood supply from the branches from the internal iliac artery. Done. Okay, then venous drainage will correspond with the what? With the arteries. Okay, just to say that we will have the renal veins, we have the gonadal veins, then we have the internal iliac veins draining the ureter. Okay, then Now for lymphatic drainage. Lymphatic drainage will correspond with the aorta. They are called lateral aortic lymph nodes. They'll drain the ureter. Okay. Then also we'll have drainage from the internal iliac arteries. So these internal iliac nodes, so these ureters, their lymphatic drainage will just follow the arteries and veins. Done. Then the nerve supply of these ureters, okay, the nerve supply of these ureters will also follow the what? The arteries. Done. They'll follow the internal iliac artery, okay, since they'll be supplied by the inferior hypogastric plexus. They'll follow the gonadal arteries and will be supplied by either the gonadal, like group of plexuses of nerves. It's like they just follow the what? The arterial sides, the arterial and the venous sides. Okay, they'll see from the inferior hypoglastic plexus and also from the plexuses which supply or which are near the gonadal vessels. Done. Okay, so that was the ureters as part of the contents of the pelvic cavity. Done. All right, so now we're going to talk about the bladder. Okay, it is its position depends upon age. So in young adults it is considered to be in fact in young children it is considered to be an abdominal organ. This is due to the fact that the pelvic cavity will be still small, so it will not accommodate like the shape and the structure of the what? Of the blood. So in young children it is considered a abdominal organ, while in adults, okay, it is considered a pelvic organ. So the bladder has a maximum capacity of holding about 500 ml of what? Of urine. Okay, it is considered to be the storage organ for what? For urine. Okay, so here we are looking at the bladder in males. Okay, in the men, it's a lateral view. Okay, yeah. So the bladder, when it is empty, it is pyramidal in shape, as you can see here. It is pyramidal in what? In shape. But now as it fills with urine, it becomes oval in shape. Let me just show you. It becomes oval in what? In shape. Then again, let us talk a little bit more about the dimensions of the what? Of the blood. So the bladder is just posterior to the what? To the pubis. Okay, this is like the pubis. This is like the pubis. Specifically the symphysis pubis, just posterior to it. That's where we find the what? The blood. Okay. It is supported to the pubis via the puboprostatic ligament in males. Okay. So it has an apex here, apex. It has a base, okay, which is triangular, this triangular base. It has an inferior angle, okay, it has an inferior angle where we find the what? The neck of the what? The blood. Okay. Then it has a superior surface. There's a superior surface. There's a superior surface. There's a superior surface, this one, and two anterolateral surfaces. One here, which we can see here, and another, this one, this one, this one. Okay. All right. So the bladder has a base, apex, superior surface, two inferolateral surfaces, okay, a neck, okay, and a posterior surface. So the neck, it enters in males, it will enter the what? The prostate gland. The prostate gland kind of bulges into the blood. Its base is bulged into the what? Into the blood. Okay, done. So that was the bladder in what? In males. Okay, and also we should take note of, I'll talk about that later. Then also the bladder, this is like its anterior relation, which is the pubis. Then posterior relation, we find the rectum, and the space between the rectum and the bladder is called the rectouterine. So the rectovesical pouch, it's called the rectovesical pouch, because when you hear the word vesical, think of blood. Then the superior surface is covered by peritoneum. Okay, the superior surface is covered by what? By peritoneum. Then the apex of the bladder is connected via ligament called the median umbilical ligament. Median umbilical ligament. Okay, I'll show you here. Via the median umbilical ligament, which is the remains of the obliterated ureters. It's called median umbilical ligament or median umbilical fold. This is like the bladder in what? In males. Okay. Another viewpoint here. The apex, which is in communication with the obliterated ureters. The base here, which is triangular in shape. Okay. The neck, which is projected inferiorly. Okay, which is in communication with what? The prostate gland, with the base of the prostate gland. Then the superior surface here, which is covered by what? By peritoneum. Then here we have like the external urethral sphincter. So the muscles which compose the blood is called the detrusor muscle. It's a smooth muscle. So the bladder has rugae inside its interior surface. We'll talk more about it. It has rugae, these folds, except the base of the blood, which forms a trigone. Okay, it's the only part which is what? Smooth. This is due to the ureters. Okay, so the muscle which forms the bladder is the detrusor muscle. So the muscle on its inferior aspect here, okay, it will fold in on itself to form the internal urethral sphincter. To form the internal urethral sphincter. Okay. Then from the neck of the bladder, we have a ureter. Okay, the prostatic ureter. Then after the prostatic urethra, we have a sphincter. This one is an anatomical sphincter, okay, which is called the external urethral sphincter. We have an internal one and an external one. The internal one is involuntary, okay, while the external one is what? Voluntary. Okay. Yeah, that was a lot. It was a lot. Okay. So yeah, this one is the bladder in females. Okay. So anteriorly, let me see. So this is the bladder in females, right? So anteriorly again we have the pubis. Then posteriorly, unlike the males, we have the uterus. Okay. So the space in between is called the uterovesical pouch. Okay, done. Then posteriorly also we have the what? The upper parts of the what? The vagina. Done. Then it is connected to the pubis via the pubovesical ligament. Done. Okay. Right, we move. So we say that the superior surface is covered by what? By peritoneum. Done. Okay. Then the interior surface now of the blood. Okay. So we say that there are folds of mucosal folds that are kind of coiled, or like they are rugae. Okay. Except the trigone of the blood. So this is like the trigone of the bladder. It is made from the openings or the ureteric orifices of the what? The ureters. Okay, as they enter into the posterior surface of the what? The bladder. They form a fold. They cause like the folding of the smooth muscle, which you call the intraureteric fold, which is like the junction between this ureteric orifice or ureteric opening and another one. It forms the base of the trigone of the what? The blood. Okay, this is like the only smooth surface of the what? The blood. Then the neck of the bladder forms the apex of the trigone of the blood. Done. Another viewpoint of the male blood. The prostate gland, communication with the neck of the bladder. Okay. Then the trigone of the bladder. Okay, here, which is the base. Then the seminal vesicles, like they form the posterior relations of the blood. Seminal vesicles and the vas deferens. Okay. So these ones, they unite to form what is called the ejaculatory duct. The ejaculatory duct will combine with the neck of the bladder to form the prostatic ureter. We'll talk more about this when we talk about the what? The prostate gland. Done. So here is the female bladder. Here is the male bladder. Okay. So the shape, I think I talked about the shape of an empty bladder is what? Pyramidal. And the shape of a distended bladder is what? It's kind of oval. Okay. Like this one. Oval. Okay. Well, that of an empty is what? Pyramidal. Done. Okay. So here is the tarsa muscle which we're talking about. Then here the trigone of the bladder. Okay, which is like the smooth surface of the bladder. Then these are the ureteric openings where the ureters enter. Okay, then this is the neck of the what? The blood. Then you see that the tarsa muscle, it enfolds on itself to form a what? An internal sphincter, which you say that it is involuntary. Okay, then you say that the neck of the bladder connects with the ejaculatory duct, okay, of the female to form the prostatic ureter. Then we also talked about an external urethral sphincter, which you say that it is what? It is voluntary. It's made from a skeletal muscle, unlike the like internal urethral sphincter, which is made of a smooth muscle. This one is made of a skeletal muscle called the urogenital diaphragm. Done. And also take note that the urethra in males is longer than that of the what? Than that of the female. The female is shorter here. Done. Okay. Then now the blood supply of the bladder, we talked about it last time. So let's start with the male. So the blood supply of the bladder is simple. Anything that is vesical will supply the what? The blood. Okay. Vesicle. So blood supply is from the superior vesical artery and the inferior vesical artery. The inferior vesical artery is also called the vaginal artery in what? In females. So these are branches of the anterior division of the internal iliac artery. This one. Then veins will correspond with the what? The arteries. Then lymphatic drainage, it will follow the what? The arteries and the veins. Okay, follow the arteries and the veins to the external iliac lymph nodes and the internal iliac lymph nodes. Done. Okay. Then the nerve supply of the bladder, okay, the detrusor muscle now, okay, is from the what? The inferior hypogastric plexus, which is composed of sympathetic fibers and parasympathetic fibers. So like most of the action of the bladder is due to parasympathetic fibers, which come from spinal cord segments S2, S3, and S4. Okay, so these ones will cause, like they will innervate the muscular part of the blood, okay, and it will cause the contraction of the what? The blood. Okay, done. And this is an involuntary action. While the like we can you know that we can, in a person who is like potty trained, okay, we can control like when we want to go to like the toilet to urinate. Okay, so we do this via the external sphincter. The external sphincter is the one which kind of helps us to hold the urine if we don't want to go to the toilet. But if, like, let's say we have a lot of urine in here, a lot of urine, it will send like these fibers, okay, the sympathetic fibers to the spinal cord. Okay, they will synapse here on the postganglionic postganglionic nerve fibers. Okay, postganglionic, then go to the spinal cord via L2. Then you cause like a sensation, like you feel like, I have to go to the bathroom, I have to go to the bathroom. Then if that sensation becomes very strong, okay, you see that like will involuntarily, like all of the urine will like, now it's time to go out. All hell will break loose when you kind of try to hold your urine for a long time. All hell will like, everything is out. Because now the external urethral sphincter will be forced to, it will like be inhibited so that it just opens. Okay, to be inhibited via the it will be inhibited. This one to be inhibited if like you overfill your blood. So the maximum like capacity your bladder can hold is about 500 mils of what? Of fluid. Okay, so you start to feel the sensation of wanting to urinate when your bladder is around 300 mils of what? Yeah, this one, 300 mils of urine. That's why you feel like the edge of wanting to what? To urinate. But you can try to control it, but the sensation becomes stronger and stronger until now it becomes a reflex which is uncontrollable. You call the micturition reflex, where the external sphincter is forced to what? To open. Okay, it's forced to open, then urine will go out. Done. So that was the nerve supply, blood supply, and lymphatic drainage. So if let's say there is maybe problems with the nerves, okay, which supply the blood, we see that the process of emptying bladder will be what? Difficult. Done. Then what else? Then another thing to note is that we say that the superior surface of the bladder is covered by what? By peritoneum. So as the bladder distends, okay, it goes up, it will cause the peritoneum, which is covering the bladder, becomes continuous with the peritoneum of the anterior abdominal wall. So as the bladder distends now, it will cause like the peeling off of peritoneum on the anterior abdominal wall. Okay, so that like there will be no space here. So let's say, for example, like the normal position in which we use like our catheter. A catheter is like a device which kind of helps us to take urine Like, let's say for example your urinary system is not working well, we can use a catheter to forcefully remove urine from your blood. Let's say the catheter is not working via this route, okay, we can insert the catheter via the anterior abdominal wall, due to the fact that the distended bladder will leave a space here for us maybe to make an incision and place our our catheter. Okay, so yeah, that was the bladder. Thank you.